And I will now call up those whose witness slips indicated they'd be offering in-person opponent testimony. First, we'll bring forward a trio. We have Nick Lashutka, President and CEO of the Ohio Children's Hospital Association. Nick is appearing alongside Dr. Steve Davis with the Cincinnati Children's Hospital and Medical Center, as well as Dr. Shefali Mahesh, forgive me if I pronounced that incorrectly, with Akron Children's, and they will testify. You may all come to the podium. You may all testify back to back as you requested, and then we'll hold the questions until the end, and we'll ask you questions at once. So please proceed whenever you're ready.
Thank you, Chair Rogner. And to be clear, we will focus our comments on the original content of House Bill 68. We as an organization have not taken a position on Save Women's Sports.
Very good.
As Chair indicated, my name is Nick Lashutka, President and CEO of the Ohio Children's Hospital Association. As many are aware, Ohio has some of the world's greatest children's hospitals, and we're fortunate to have 6 of them in our state. Many states do not have a children's hospital. Not only do we have some of the best and brightest, we have 2 ranked in the top 6, including the #1 ranked children's hospital in the country, who's Dr. Steve Davis, who's here with us this afternoon. We serve all of Ohio's 2.6 million kids, regardless of their family's ability to pay. Our mission is to save, protect, and enhance children's lives. We are committed to improving all aspects of children's health, especially and including behavioral and mental health. We are in the midst of a behavioral health crisis. I think that's not a surprise to Republicans, Democrats in the House or the Senate, and we're concerned about the provisions in this bill that will have a negative impact on that. Substitute House Bill 68 uses false information to strip away parental rights and impose non-scientific restrictions on pediatric healthcare specialists. It bans all medical treatment with age-appropriate medications that are used in extremely limited but critical circumstances, and this bill also creates broad, sweeping barriers for access to mental health services that we have a great concern about without justification. This is a small but extremely vulnerable and high-risk population. Our hospitals have devoted multidisciplinary teams of specialists to support their well-being, and importantly, this bill does not distinguish current patients from new patients who may present in our institutions. And we're concerned about what would happen to the existing patients that we see should House Bill 68 become law. Oh boy, we need a combined time. I'll have to go quick, sorry. Let me be clear, we do not perform surgeries on minors for this condition. There's been allegations made that we do. You'll hear from all of us, we do not do that. It is not a standard of care. And our clinics were established to respond to the needs of families and youth who needed help. The foundation of these clinics is to support families and youth with their mental health needs first and foremost. I'll have Dr. Davis and Dr. Mahesh talk about that process in the interest of time, Madam Chair. I wanted to just dispel some of the myths that have been levied against our institutions and for this population throughout the last 3 years in this legislative process. Number one, as I mentioned, these clinics in our hospitals have responded to a need in the community to serve a very small but complex group of children. 2, there are 2.6 million kids living in Ohio, as I mentioned, and about 1/3 of the individuals who are diagnosed with this condition are presenting under the age of 18. This is 0.0003% of the population of kids in the state. All medical gender dysphoria treatment requires parental consent, like everything we do that's non-emergent in our institutions. It's supported by a multidisciplinary team of professionals, including specialists in psychiatry, adolescent medicine, and endocrinology. Again, we do not perform surgeries on minors for the condition of gender dysphoria. Individuals diagnosed with this condition are consistent, persistent, and insistent for a lengthy period of time. The notion that kids declare a feeling and are immediately prescribed medication at one of our clinics is not true. Patients do not self-diagnose for this condition. They present with symptoms, and the healthcare providers in our hospitals evaluate these symptoms, and only they make diagnosis. All comorbid mental health conditions are screened for and evaluated prior to any determination about whether additional treatment is required. Patients do not receive puberty blockers or hormones at their first appointment, as has been accused of us. The average age of a patient in our clinics is 16 years old. All of our care is safe, age-appropriate, evidence-based, and aligned with current standard medical practice guidelines. Keep going? Okay, at a minimum, this committee in the Ohio Senate, we're asking you to do 4 things. One is include a grandfather clause for current patients so that their course of treatment can be continued should this bill become law. 2, remove the barriers to access mental health that I referenced. We're in the middle of this crisis. We don't need to be erecting new barriers, whether it's in our hospitals or in the community setting. 3, allow for physicians to provide comprehensive care information to their patients. And 4, create a pathway that can be rigorous, can have multiple steps and a higher threshold, so that medication treatment can be used in extremely limited circumstances. And I'll turn it over now, Madam Chair, to Dr. Steve Davis, CEO and President of Cincinnati Children's Hospital.
Madam Chair, committee members, I'll try to be brief and not repetitive. I'm Dr. Steve Davis. I'm a pediatric critical care physician, over 35 years experience, the last 28 in Ohio. I have dedicated my career to caring for critically ill children in Ohio. The most harrowing aspect of my job is informing parents that their child died, especially when their death is from a preventable suicide. Today, I stand here to urge you to reject House Bill 68, a bill that, if passed as written, would aggravate our children's mental health crisis and lead to unnecessary deaths. As CEO, I have the privilege and responsibility of overseeing the most respected children's hospital in the nation. We have 19,000 employees and over 1,900 medical staff. We are Cincinnati's second largest employer and a trusted member within our community. We are also the country's largest provider of mental health services, and we see a dire need every day as children wait in our emergency department for mental health placement. House Bill 68 in its current form would hinder doctors and parents from collaboratively deciding the best treatment for their children, leading to untreated mental health issues and preventable deaths. Despite common misperceptions, the number of children diagnosed with gender dysphoria is quite small. However, these children are among the most vulnerable. An estimated 20 to 40% of homeless youth are LGBTQ, many of whom were forced out of their homes. Transgender youth face significantly higher risks of suicide attempts and depression, and transgender youth are more than 8 times as likely to attempt suicide and 6 times as likely to be depressed. At Cincinnati Children's, our gender-affirming medical care for adolescents involves comprehensive assessments, rigorous mental health evaluations, and screening for comorbidities. Hormone therapy, often misunderstood, is not prescribed lightly, and many patients are never prescribed hormone therapy. The physician works with the patient, family, and mental health provider to determine the best overall treatment course depending on the individual situation. We do not start hormone therapy without this thorough evaluation. The average time before treatment starts is 10 to 12 months. I support all 4 of the amendments that Mr. Lashutka presented, and I will try to skip towards the end. Restricting our ability to provide such care places us in an incredibly difficult position. I welcome you to sit down with me and our providers to learn more about the services we offer. There is no financial incentive to provide comprehensive care. We do not make money on providing this care. Cincinnati Children's is globally respected. You trust us on every other condition. Please trust us on this one. Thank you for allowing me to testify today and for your careful consideration of this matter.
Chairwoman Brogner, Vice Chair Antoni, Ranking Member Hicks-Hudson, and the members of the Senate Government Oversight Committee. My name is Dr. Shefali Mahesh. I am the Dr. Noah Miller Endowed Chair of Pediatrics at Akron Children's Hospital and the Chair of Pediatrics at the Northeast Ohio Medical University. I am addressing you to express Akron Children's Hospital's opposition to Ohio Bill 68. Akron Children's has a mission to treat every child as if they were our own, to treat everyone the way they would want to be treated, and to never turn a child away. We provide care to children who show up at our door for any medical condition, including those related to gender identity. True to our mission, we simply cannot turn these children away. Instead, we have developed a comprehensive approach to treating gender dysphoria, which acknowledges its complexity and the need for a multidisciplinary approach to its management. Our Center for Gender-Affirming Medicine has provided multidisciplinary and family-centered care to transgender youth through rigorous, thoughtful, evidence-based practices. Our comprehensive approach includes a detailed intake process, followed by numerous interactions with mental health professionals, social workers, adolescent medicine providers who are trained in the emotional, psychological, and developmental stages of these children. At Akron Children's, we care for over 320,000 unique patients every year. Only 0.0015% are under the care of our team in our gender-affirming care clinic. 100% of our patients in these clinics are supported by a therapist. The rigorous assessment is designed to evaluate the persistence of the child's gender preference, understand the social and psychological context of their gender identity, and how it might intersect with other mental health conditions. In 80% of these patients, mental health therapy is the only treatment needed. While the proponents acknowledge the importance of mental health, House Bill 68 creates additional barriers to mental health therapy. Only 20% of children may require medications in addition to the individualized counseling accompanied by their parents and supported by their parents to ensure that the path they've chosen is best suited to their needs. Most patients receiving any medication at Akron Children's are 16 years of age or older. Any medical treatment is initiated after parental consent unequivocally without intimidation or coercion. Recently, we hospitalized a gender-diverse patient who purchased hormones off the internet and was injecting this unknown substance into their body. By restricting access to care for these patients, we will not only see an increase in our already unmanageable mental health crisis, but we will see an increase in dangerous medication-seeking behavior that puts these children at risk. This also results in potential skin, fatal bloodstream infections due to youth self-administered, unregulated medications. All right, I'm going to wrap this up really quickly.
You may wrap up your remarks. Go ahead.
Okay, thank you. House Bill 68 goes against the basic principles of medicine. The healthcare should be individualized based on each patient's internal and external environmental needs, with an emphasis on shared decision-making by patient families and their healthcare professionals. The passage of House Bill 68 will result in catastrophic unintended consequences for an albeit very small but very highly vulnerable number of Ohio adolescents who desperately need professional advice, guidance, and treatment from a team of pediatric and adolescent experts. Please don't create an environment in which a vulnerable population of Ohio kids and their families are deprived of the health care they desire.
All right, well, very good. Thank you, Mr. Lashutka and Doctors Davis and Mahesh. Thank you for your testimony today. Thank you for being here. Are there any questions for these witnesses? Senator Brenner.
Thank you, Chair. Thank you, witnesses. Can you compare and contrast what's going on here in Ohio or in the United States versus, because there have been articles that have been out about Sweden changing some of their practices, how we've been doing it versus what they've been doing in minor and trans gender-affirming care over there?
Madam Chair, Senator Brenner, thank you for the question. And we do have experts, if we want to go deeper into this, who'd be prepared to help answer it. But the short answer is no European country has banned gender-affirming care. Some countries are reorganizing their care into multidisciplinary regional clinics, which is reflective of the manner in which Ohio's children's hospitals have organized these clinics.
Follow-up?